You're listening to The Outcue, a 21 News journalist perspective on a top news story.
Good afternoon. It is Friday, August 30th. I'm Assistant News Director Justin Mitchell, and once again, this is The Outcue. Last week, we discussed the constantly moving picture of the Steward Health bankruptcy and what impact that may have on the community. And I think I may have said at the end of it that there was a good chance that we would see where we were by this time next week and see if there was more discussion to be had. And the answer, in a word, is yes. So with me again is Senior Digital Content Manager Robert McFerren. And the lens we're looking at this through today, as the Outcue is a place to look at the way news operations work to make sure that we're doing the best work that we can, is that this is one of those stories where if you aren't very, very diligent, you will find yourself knowing more than you've reported. And that will always be the case when there's information that's, say, off the record or on background or speculative. But what you don't want is things that are important and on the record and reportable to slip through the cracks because the flow of information is so heavy. And Robert, this is one of those, right?
It's exactly one of those.
I have found myself reading scripts, knowing what work went into it, knowing what we knew going in, knowing there's only so much time in a broadcast script, and going, oh, geez, there's so much important info here that we can't fit in here. What are we going to do?
Yeah. I mean, as last night, as news was changing very rapidly last night, starts with a phone call to the newsroom who tells us, hey, you need to watch for a court filing. They gave us some information. We started looking, and things started changing quickly. We were already covering the story, but now we've got a different angle we have to look at and find things quick. So.
And this angle would be that there's actually a bid and financing secured now from a nonprofit group, not the one we've been telling you about, but working somewhat in conjunction with that group to try and take over operations of Trumbull Regional Medical Center and Hillside Rehabilitation Center.
We'd seen the name on the court filing for the objection.
Which is Western Reserve Health Education, right?
Correct.
Yes.
Yes. Yeah.
So we've seen their name, but we've got to on the fly figure out who they are.
Yep. Yeah.
And at the same time, though, I found, and I was off yesterday, so I found myself having to backtrack a little bit as to what we knew and what we'd reported. Yeah. And there was a ripple effect. There was a story we had done on Wednesday that we started the day with. There was a plan spearheaded by Trumbull Commissioner Nikki Frenchko to try and get the governor's office's attention to try and get a public health emergency declared. Yep. So we did that story.
Right.
There's the problem. Wednesday morning, that's the focus of the whole story. And then what are the calls we start taking?
We start taking calls how things are just rapidly changing, on the entire situation. And is it going to matter? Because now we have a bid that they're saying we have the funds for this. We have the money to take over, the operations. We have the money for the first 90 days. It's going to be filed, but we don't really know anything about this organization. And
well, see, I think you just proved the whole thesis of this. Because that was yesterday.
You're right.
I'm going back further.
Okay.
Wednesday, the calls we start taking are, they're diverting ambulances.
You're
Trumbull
right.
Regional the ER is only taking walk-ins. They're diverting ambulances. This all has to be in today's story.
Right, and so we're chasing that, trying to get, see, it's all blending together. It changes so fast, but that was the big story 2 days ago that, because this obviously is a health emergency. If I'm going to the wrong hospital, that they're diverting, this is a matter of life and death. Right. So we need to be able to report this and let people know.
And so sometimes, we're very used to, the angle will change in news. Yeah. The story changes, particularly when it's changing rapidly. But a lot of times when that happens, the original angle becomes moot as you move on to the new one. Yeah. Well, that wasn't the case here. The original angle was really important. Yeah. And it no longer fit in great detail in the on-air story. Yeah. Could have fit in the online story, and but you also have to just keep track of all of the information. So then we get into yesterday, and the story planned was there's a vigil to save the hospital, which is emotional, but usually those are personal stories. Right. They're what we'd call people angles, right? Not necessarily a lot of new information on the bone, not a lot of facts, right? Yep. And of course, it continued that way, and everything ended then, and everything was all right. Nothing new happened, right?
Yeah, literally, it was.
So what's the first call that comes in yesterday that there is something seriously brewing?
It was an anonymous caller that said they didn't want to provide their name or their number, but they said, here's the name, and I'm writing this down like, the Western Reserve Health Education. They were filing, or they said they have the funds and the 90 days. I'm like, have they filed with the bankruptcy court? Because we check Pacer, which was where we get the court documents from. With this case, every couple hours at least, because it comes in that fast. It's also in Texas, so they're an hour behind us. So lots of times at the end of the day, we'll get a document dump of lots of updates on, and again, this is Steward's a national chain, so you get lots of things that don't pertain to our area, so you've got to dig through them and find what's our angle that impacts our people here locally and us.
And so we're not seeing it, but we start to work sources, because there's some confusion, because we've been talking. You've seen John Woods on our 5 o'clock news, you've seen him in our news stories and John Graneri, and these are the people representing Warren City Hospital, Inc. So now we're reaching out going, well, wait, is this the same thing? Is this different? What does this mean? And so what we find out is that it is sort of a shift. They're all sort of working together. And the difference here is that Western Reserve Health Education is an established nonprofit.
Yes.
So hurdles that Warren City
was trying to
has
get
been
past.
seeking to overcome, they've essentially done so by partnering, as it were, with this group. So now they're in the lead.
Yes.
So now we have to figure out who they are.
Right. Yeah, because all we had was a name that you should reach out to.
And so I did, and we have a statement from Kim Howe from Western Reserve, and it essentially just says, look, we hope our efforts are successful, and we won't rest until we do everything we can to save this hospital. So now we got to report that. But wait a minute, I just told you at the beginning of this conversation that there is an effort to get a public health emergency declared, and that seems pretty significant. We're 3 steps beyond what it seems like is that story, and guess what? We haven't told that story yet, because too much new came in, but that was still a moving effort. So I had a long phone conversation with Commissioner Frenchco yesterday, and I relayed information to Chris Sarinelli, who was going to be covering this rally, because I said, listen, the people angle is important. We need to talk about how this is impacting people. But we also need to, that almost has to become secondary to the moving parts on the ground as to what's being done so that these worst case scenarios are not realized. So
this is being done while you're on your day off, and I'm driving to work the fair shift. So it's like we're all trying to handle
and day off. This is also 6:30 at night. I mean, it wouldn't matter. There's you got to take calls when you have to take. In fact, there was a moment where we were laughing because I had responded to a message once while I was coming out of anesthesia, and I didn't remember what I had said, but you're just always working, and you're like, I didn't say anything wrong, but you go, be careful, So in the course of that conversation, it's more clear than ever to me that this effort to get a public health emergency is really, really important for a number of reasons. Now, the first one is, what would it do? Which is, it allows more flexibility for, things like one potential, and this is only one potential, is to use an element of the eminent domain laws to make this whole deal more affordable than the $78 million price tag currently attached. And that's for operations and certain amounts, and the land and the hospital and everything. But this is arguably inflated due to the bankruptcy process. I don't know, but you need somebody to step up, and you need to raise the money.
And this is an effort we're seeing in Massachusetts with their governor trying to do the same type of thing. So that's why we're trying to see, can't we do that here as well to save the hospitals? Yes.
Yeah. And so what struck me in my conversation with Frenchco was, there's a lot of homework that's been done here. And there's things that the governor's office were maybe not completely aware of that they are taking into consideration now. I don't know the timeline, and we don't know what they're going to do, but those things are like the barriers to care, you can look at a Google map and see that St. Joe's is 5 minutes from Trumbull Regional Medical Center. But what Frenchco and others had put together was, that's 5 minutes in ideal conditions, but in between is a diverging diamond construction project that has it at some points a single lane, and when there's heavy traffic at different points of the day, that 5 minutes can turn into 40. And if you have an ambulance being diverted in an emergency situation, that is an untenable crisis potentially.
You're right.
The number of mental health beds offered by Trumbull Regional is an insurmountable problem if we don't have a plan for dealing with, and that's even if Mercy is doing everything they can to step up.
Yep.
And what else? There's also the doctor-patient ratios in Trumbull County. So in the United States, and I don't have the figures in front of me, but there's the doctor-patient ratios in Ohio are worse than the national average, and the Trumbull County doctor-patient ratio is worse than the Ohio average.
Yep. Then we've got the 911 center and the coroner's office that are also in the
the county morgue is in Trumbull Regional Medical
So if
Center.
this building closes, what happens?
So there's a ripple effect beyond what we're all talking about.
Yep.
Yes, the 911 center has critical infrastructure there. This is a potentially devastating effect that's going to affect, Mercy Health. It's going to affect all the residents of Trumbull County. It's going to affect county operations. There are a number of reasons why this is really an emergent thing.
And the clock is ticking.
and the clock is ticking. And so I bring all of that up because this is something that we knew, at least in part, earlier this week. And developments came in so fast that if we weren't super diligent, we may never have told that story because so much new happened in the interim.
Right. We're living with this. We're thinking we know it, but then wait, we haven't told others what we know. So,
So this is not the first story that's been that way. East Palestine comes to mind as one where information came very, very fast and furious. And probably I've never seen anything like the onset of COVID was like that. I've never seen information come in so fast and furious as it did in the early days of COVID. So there's only so much time in an on-air broadcast. So how do we do all this? How do we fit it all in?
Well, that's where the web is lucky, because web is endless. We can write as long as people want to read on there, which is good. You got to keep them interested. You got to get the information out there. Decide, like we said, we just went through all these different, do we put this in one story? Do we break this into multiple? How do you go by digesting this so people can have this information and know what they need to know?
And I guess what we have to do regularly is remind the viewer that we will have their back on all of these things. So number one, we have to do that. We have to deliver. Number two, we have to let them know that we're delivering and where they can get their information. But isn't there some onus also on the viewer or on the audience or on the reader that there's too much to put in one specific place? So we're going to curate it as best as we can for you. But please know that this is not a time where you can read a headline and know the story. You do need to, there's a lot of information.
I mean, we're covering all the different angles, from the local to the court angles to the proceedings, and there's multiple groups filing because you have different, you have the people that own the leases on the buildings, and you've got all these moving parts and players in this that you have to just be able to know who is this? What are they doing? What's their goal here? What's their involvement in this? So it's a lot.
And isn't that also, like, I guess when in doubt, you have to get back to the fundamentals. And one of the fundamentals is headlines, right? So I can say that we need you to read everything, but I'm realistic. If you could read everything, you'd be reading the dockets I'm reading, and you'd have the time. I mean, our job is to distill this for you, and we're certainly aware of that. So verbiage is very, very important. Making sure that you organize the information in a way that's easily understandable. And let me tell you, folks, if you've never read a bankruptcy docket, don't. Just don't. I read court dockets all day long, so do you. Bankruptcy dockets are an entirely different breed to make heads or tails of what you're talking about.
Who's the player? The plaintiffs, and you got the debtors, but you got multiple debtors in this case, and multiple people involved in this, and you're trying to keep track, and they're all objecting. All their attorneys are objecting to. whose attorney are you? And yeah.
I mean, for instance, there's a hearing coming up next week on Western Reserve's bid. There's a hearing today that has to do with canceling leases. And, that's coming up in the next hour or so. And I have no idea, based upon what's on the docket, what the significance is. Now, you can dial in and you can listen, and we're going to be doing that. But
as we know, today's the deadline for Sharon to have.
Sharon Regional, yes. Sharon Regional was given a hard deadline to have their money or warn notices, which is when you let workers know they're being laid off and they're going to begin the closure process. That could start any time with Sharon, or they could get a plan approved. That could come literally any second as we're sitting here. And it also may not have come by the time you're viewing this, and we may not know anything until the middle of next week. Another thing about federal court is that filings can happen 24 hours a day, and they do happen on the weekends too. So you never quite know what could happen there. So what I was getting at, though, was in the verbiage is talk a little bit about the importance of things like a headline, or what's a push notification, or what an anchor should read.
I mean, headlines, I've got limited words I can get in here that have to be able to convey to you what's important here. Here's why you need to know this. So I've got to be able to write this sharply so here's what I need to know for this story. Push notification, same way, because that's how we alert you that, hey, this is an important story. You need to look at it. So we try to push all of our stories that we feel are important to you. So,
and if you get a push from us and go, I don't know, I don't understand that, or even worse, this doesn't make sense, or even worse, I'm not remotely interested in this, then we have failed somewhere. I mean, if that's a lot of you, obviously nobody is in universal agreement with anything. So we need to make sure that we can distill all of this into what's important and what you need to know. And that's the work we're putting in every day. And I know that sounds almost like a commercial for our news organization, but it's really like, this is the behind the scenes look that this podcast exists. Is there's at any given time so many balls in the air to gather the info, make sure you're not missing anything, make sure you're staying up on it.
Our goal is always to have a plan in place, but our plan is also changing every second of the day. So it's one of those that we just follow the news.
Many days during the course of this, and this may be the case for a while, there's generally a reporter who's just sort of assigned to Steward today. And I can't give them a ton of guidance as to where it's going to go. We can all just keep up on it.
We wait and see where the wind's blowing today.
And that's been the case. I mentioned these other stories with East Palestine. It was that way. There were news conferences for a while there were news conferences twice a day for at least a week or two.
Or sometimes it's the opposite. With Realty, we were trying to get more information and
and trying to distill it. And I mentioned COVID because, I mean, that was a time where we were doing everything from a separate half an hour special to coverage that was filling up for a while. They're filling up our entire first block.
We'd always have the daily newscast from the governor that we'd have to follow and listen to and report on.
And that's a good example too, and I'm glad you mentioned that, because what I remember about those is that the information coming out of the governor's office was very crucial in the beginning, and then it started to waver before they tapered off. But there were numbers that came out every day. And raw numbers are garbage without context. So we would have to go through and say, all right, listen, there's this really high number today. But look at the hospitalization trends. They're going down. We're seeing more infections, but we're seeing less sickness. Or the opposite, today's numbers look really, really rosy until you see that last week's numbers are all getting admitted to the hospital now, and we got a bit of a problem. This is not the stuff that's easily fed to you, so you've got to have a working knowledge of what you're working on and why it's important. So it's, what is the information? Why is it important? And how do I explain it?
That's how we make our sausage. Put it all in the grinder and we get it out to you.
I often find that, and we're passionate about the work we do, so
absolutely.
I find that unless I'm real burnt out, I'm going home and there's at least one story, usually the big one, that I'm going, you're not going to believe this, and I'm telling my wife about it, right?
Every day.
But that's how you tell the viewer too.
Oh, yeah.
Don't come off
Yeah.
wonky. Don't
No.
come off
Yeah.
like you're, in an institutional report.
Yeah.
Basically, if I know why this is important and I'm interested and I'm going to share it with somebody
Yeah.
in my spare time, that's what you need to know.
We talk to our viewers like we talk to our family, our friends. This is what you need to know. This is how you need to know it. Yeah.
And all of that just comes back to the role we play in this valley, which is that we do work for the valley. We work for the people here. We need to look after them. We're one of the last lines of defense for looking after your interests, just to make sure that somebody's not putting one over on you.
This is not just a factory, and not saying factories aren't important, but this is a healthcare facility. This has greater ramifications. There's supply chains that feed into this. So there's lots of jobs. There's lots of healthcare issues that we need to take care of. So there's a lot more to this than just it's a hospital.
Right. I mean, to that point, when you lose a factory, that can be devastating to a community, and the impact is almost strictly economic.
Right, because people aren't necessarily buying your widgets that you make here locally. But yes.
But in this case, you have an economic impact, you have a public health impact, you have a county government impact and a city government impact, and you have, we did a story earlier this week where the estimate for the city of Warren alone is that they could lose upwards of $1 million a year if they were to lose that hospital. Now, if that happens,
then job cuts could happen.
And we're not talking job cuts at the hospital now. We're talking about
your public sector that paves your roads potentially, or protects you, or
how
your
many
fire
city departments are there, right?
Yeah.
There's police,
Your
there's
parks,
fire, there's roads, there's parks, and any one of them is going to need to be assessed.
Yep.
And that's not something that you're necessarily thinking about if you don't directly go to that hospital.
Right.
But that's the entire county, that's the entire community, that's the entire city.
Yeah.
And it's a statewide issue too. I think that this is an issue that impacts the state. This is why the governor's office is now being brought into the discussion. But they've been, quite frankly, our sources have told us, lukewarm. They've been interested and then not interested, and now they appear to be interested again.
Yeah.
So by this time next week, we could have a lot of answers, or we could be exactly where we are right now.
And this is where our viewers can help. You can also call the governor and say, this is important to us.
Yes. And you can call us and tell us about your experiences.
Yes.
We've had a lot of that lately. We've had people coming, who either, you don't know who they are. Are they employees? Are they customers? Or not customers, patients?
We had lots of calls yesterday that were telling us, as the diversions were happening, or there's a long wait, or you need to check into this. I mean, the phones were ringing off the hook with these type of calls yesterday. And as these types of things happen, if you have something, call us. Absolutely.
Yeah. And that's how we end most of these, is by pointing that out, that you can reach us at 330-744-8821. You can email us at news@wfmj.com or watchdog@wfmj.com. And, I don't know how often I reiterate this, so I will, particularly for a story like this, I want to reiterate that we're not looking to necessarily publish who you are. Obviously, if somebody who's an employee wants to speak out in their personal and professional capacity, we will give you a forum to do that. But many times with a case like this, if somebody wants to tell us about what's going on inside and they fear, whether it be retribution, or they simply don't like the spotlight, or they don't want to make an enemy and they don't know who it is, whatever the information you have is, please know that speaking to us, I mean, I've never betrayed a source.
Never.
I'm sure you haven't either.
Never.
And so that's, decades and decades of experience here. And I think it's important that you know that, because there are people out there who are seeing things that it would behoove the public to know, and they're not necessarily going to get it through official channels. We will not run with anything that can't be verified. And so we don't just encourage people to tell us things that we can't check on, but we will protect you if you have a firsthand account that you want to share. With that, I hope that by this time next week, we are able to give an update on Steward and talk about yet another aspect of our news gathering operation, and not hanging in the same amount of limbo that we remain in right now with the future of these hospitals in Trumbull and Mercer County. Until then, this has been the Outcue.